Good afternoon, everybody. Thank you for attending this late session. I'm going to talk about a bit late but very serious complication. So it is called wound burn or corneal incision contraction. It is produced by the phaco probe. As we see, the phaco probe has oscillating or vibrating needle and surrounded by sleeve and the opening for irrigation. So this is very important to understand. So the probe will create two types of heat due to the friction of phaco-emulsification needle and vibration against the sleeve. So if the flow of the irrigation fluid surrounding the phaco-emulsification needle is disrupted due to many causes, the generated heat will cause thermal damage to the collagen fibers in the corneal tunnel. When the temperature reaches 60 degrees Celsius, this will lead to phaco burn over 1 to 3 seconds. The wound burn results in the contracture of the incision site and surrounding tissue. So what are the risk factors if you are dealing with a mature cataract, because you will need more energy, or you use a higher level of or prolonged use of the phaco energy, or the type of surgical approved use for nuclear disassembly if you are using divide and conquer, or obstruction by OVD of high viscosity of the tip of the phaco probe, or manipulating or pressing to one side of the wound. So this is a video of a very hard African cataract. So after doing most of the cataract and remove the pieces, now you can see the signs of the wound, gaping of the wound and whitening and of the incision side, and even iris prolapse. So after doing this and putting the IOL, still the wound is unstable. So if you are doing irrigation aspiration, even after taking one suture, it is not stable and not secured. So I had to take another suture and have to close also the paracentesis. So the complication of this, you may have a delayed wound healing, fistula formation, damage to corneal stroma and endothelium, inability to close the incision, and increased surgically induced astigmatism. You may take 2, 3, 4 sutures to secure the wound, and flat anterior chamber. So what are you going to do? Intraoperatively, you have to suture the wound by radial suture. Sometimes you may need a horizontal matrix suture to oppose the edges of the wound. Or sometimes you will do a tenon, autologous tenon plug, or you can use a scleral batch graft to close the wound. So thank you, and I would like to invite you all to the next international meeting of the Egyptian Society of Cataract and Refractive Surgery next week in Cairo. Thank you very much.
Thanks, Mostafa, to be on the time, and thanks for this excellent videos. And I think that we will postpone all the questions to the end, and we will ask for Dr. Ashraf Armia. He is very exciting to present this phaco nightmare scenario in a way that he was away from my side, so he didn't sit as a panelist. Anyway, so until you will have the presentation, Mostafa, I think that the phaco tip shape can play a role in preventing that. Phaco tip shape, yes.
Yeah.
Can have any role in preventing the burning of the incision.
The phaco tip.
Yeah.
Yeah, you have to be sure about the sleeve properly. Apply to the probe. Also, all the time you have to move with the probe inside the tunnel freely. Don't push one or manipulate the wound too much. Also, you have always watch for the irrigation. One tip, it's very important that before starting the phaco, you have to be sure that the tip is not occluded by viscoelastic. In such cases, you tend to overfill the anterior chamber with the viscoelastic. So,
especially with school.
Yeah, there is something we call a phaco well or pocket before. Just start doing a pocket to allow the fluid go around the tip before doing the rest of the.
Thank you, Mustafa. As far as that, I like the nightmare, and I like to to attend all the movies for the nightmare. I congratulate Ashraf for the presentation.
Can I comment in the wound burn? Two things can prevent you from wound burn. Too tight wound, long tunnel in a hard cataract equals wound burn. Two, when with the side port, if you inject viscoelastic a lot, sometimes it clogged the trickling of the fluid. So you are going to be stuck. Phaco against stop track, definitely heat will be created in the wound. So these are very important.
The tip shape, why comments, the tip shape now, it has the movement that prevents the tip, the angulation
the
of the
tip,
that prevent the movement at the angle. Because movement at the angle with this high power, 100% we will create. Again, apart from the incision size, then in the incision, and always just keep methylcellulose, which is the dispersive. In my opinion, dispersive, definitely I'm using dispersive and course cohesive, but dispersive in continuously, inside, from in, out. Dispersive is continuous. I'm continuing using dispersive. And in spite of that, I will have a small patch of burn, but not the burn that needs suturing. I think that we need to proceed because nightmare, it will be, see the shape of it and everything. So we will not sleep at all. Please, Ashraf. Yeah, nice music.
Still, it's coming.
No.
So I love action in the last of the meeting because